Hello friends, let us now learn some important points about the laryngeal trauma. Before we go into the details, this picture shows the laryngeal inlet in inspiration, where you can see the uh, bruising of larynx here, and this is the larynx in the phonation, where you can see bruising, all these redness of the larynx, bleeding, all these are seen. So we will see about the laryngeal trauma. First, etiology of laryngeal trauma. Laryngeal trauma can occur due to accidents, road traffic accidents or automobile accidents. Sometimes in any case of blow on neck, or if someone kicks on the neck, or if there is any strangulation or penetrating injuries on the neck. All these will result in laryngeal trauma. Now, the degree of laryngeal trauma and severity of laryngeal trauma vary from slight bruises to tear. There can be just small bruises to there can be the tear of the laryngeal mucosa, or sometimes there can even be fracture of laryngeal framework. All of that depends upon the severity and degree of laryngeal injury. These laryngeal fractures are more common after 40 years of age because of calcification of laryngeal framework completes by the age of 40 years of age. So once the calcification is complete, obviously the fracture can occur in more than 40 years of age. In children, if you see, the cartilage in children is more resilient and escape injury can occur. The pathological changes of laryngeal trauma are there can be hematoma or edema in the subglottic region. Just a minute, I will show you a diagram. First, there will be first and foremost edema and hematoma in the glottis and subglottic region. There can be tears in the laryngeal or pharyngeal mucosa. The cricoarytenoid joint which is present, that can this is cricoid cartilage, this is the thyroid cartilage. Here on the back side you will find the arytenoid cartilage. There is cricoarytenoid joint that can get dislocated. Cricothyroid cartilage can also get dislocated, and this cricothyroid cartilage dislocation will result in laryngeal nerve, that is recurrent laryngeal nerve paralysis can occur. The hyoid bone, it's not shown here properly. Okay, there can be even hyoid bone fracture can also occur. The thyroid cartilage fracture can occur. This thyroid cartilage fracture can be either transverse fracture of thyroid cartilage can occur, or vertical fracture of thyroid cartilage can occur. There can be fracture of cricoid cartilage also. There can be fracture in the upper tracheal rings, and trachea may separate from cricoid cartilage and retract into the upper mediastinum. This cricoid can separate from the trachea, and the trachea can retract into the upper mediastinum. Anything can happen, but all of these depends upon the severity, degree and mode of injury. So because of all these, the clinical features can also range from mild to severe. There can be respiratory distress. Whenever there is recurrent laryngeal nerve palsy, it can result in hoarseness of voice can occur. There can be painful swallowing, that is dysphagia can occur, and there can be pain while talking, and sometimes there can be hemoptysis can also occur in the larynx. On examination, the examination can range from bruises or abrasions from the skin, it can occur. There can be mucosal tears which can result in emphysema. surgical emphysema can occur. You can find the fracture displacements of either thyroid cartilage or cricoid cartilage or trachea, anything based on the things that can happen. Anything can be seen on examination. So what do you do for evaluation of this case? You will have to do indirect laryngoscopy can be done if the patient permits. This indirect laryngoscopy will reveal the location and degree of edema, hematoma, mucosal laceration, posterior displacement of epiglottis, exposed fragment of cartilage. All those can be found out by indirect laryngoscopy. Direct laryngoscopy is not much useful, right? But nowadays we do fiber optic laryngoscopy instead of direct laryngoscopy. Fiber optic laryngoscopy can be done instead of direct laryngoscopy nowadays. You can also do X-ray, especially X-ray is done for surgical emphysema, to find the swellings of the laryngeal mucosa, if there is hematoma. Especially the X-ray is done for any type of fracture of bone, fracture displacement of hyoid bone, or sometimes thyroid cartilage and cricoid cartilage can also be seen in X-ray. Okay, so based on the fracture displacements can be seen in X-rays. Then CT scan. But among all these, X-ray not much useful, because even if you see the fracture of hyoid bone, good, but fracture of thyroid and cricoid, maybe they can be visible, but not to the extent that we can clearly visualize without any doubt. So for that, the best investigation is CT. Especially CT scan is most useful investigation in laryngeal trauma, because this will not only delineate or assess the fractures and dislocations, it will also assess the emphysemas or swellings, hematomas. All those can also be found out from the CT scan. So once you have found out the injury, then treatment mainly depends upon the injury. But before that, you will have to first stabilize the patient. If there is any respiratory distress, you will have to first give oxygen therapy. But still, after oxygen therapy, if the respiratory distress does not decrease, then you can do tracheostomy in these patients. Voice rest should be given, very essential, because if there is some hematoma, lacerations, all those can increase if the patient keeps on talking. Then you will have to give humidified inspired air to the patient. Then you will have to start the patient on steroid therapy, that too immediately. Full dose of steroid therapy is given to the patient. This steroid therapy will decrease the edema, and also hematoma will also be decreased with the help of steroid therapy. Then we will also have to give the antibiotic therapy should also be given to the patients to prevent infections and also to prevent perichondritis, that is infection of cartilages of larynx, and cartilage necrosis can also be prevented by antibiotic therapy. So if there are any fractures, we can do open reduction, or you can do internal splintage can also be done if there is any laryngeal fractures. If there is open reduction, needs to be done in 3 to 5 days. In 3 to 5 days after injury, we should do open reduction. If possible, this open reduction should not be done more than 10 days. Fractures of hyoid bone, thyroid cartilage or cricoid cartilage can be wired and then placed in anatomical location. Right? Next, what are the complications of this laryngeal trauma? So if you see the complications of laryngeal trauma, they include, first there can be laryngeal stenosis. Because of the laryngeal trauma, the fibrosis occurs, the healing occurs. In the process of healing, there is deposition of fibrous tissue which can result in closure of laryngeal inlet, which is called as laryngeal stenosis. There can be infection can enter the larynx, and it can cause perichondritis of larynx, and if this perichondritis of larynx can further progress to laryngeal abscess, it can progress to laryngeal abscess, and this laryngeal abscess will decrease or prevent the blood supply, leading to laryngeal cartilage necrosis can occur at the end. So in order to prevent this for occurrence of perichondritis, laryngeal abscess and laryngeal cartilage necrosis, we give antibiotics to the patient. And there can be vocal cord paralysis also, especially due to the palsy of recurrent laryngeal nerve palsy or superior laryngeal nerve palsy. So this is about laryngeal trauma. Thank you for watching my lecture. Thank you.